Two experimental drugs are being called a significant step in the fight against lung cancer. They were designed for those who are forming resistance to other available treatments. Several new drugs have come on the market to treat lung cancer over the past several years, and they worked well at first. But doctors say most patients develop a resistance to those medications, and tumors, which had shrunk with the drugs, grow back. These two new experimental drugs are for people who have developed that resistance. Of all the people who developed the most common form of lung cancer, about 12% of them become resistant. The experimental therapy found that in 127 patients, 61% saw their tumor shrink. It appears as if this new treatment has fewer side effects, as well, with only 6% experiencing serious side effects. Researchers are quick to point out that this is not a cure, nor is it a long-term solution, but could prevent tumors from growing for another 9 or 10 months. The drug should be available on the market later this year. The specialists from the Center for Medical Imaging explain the advanced screening options they now offer for lung cancer.
In the old days, when CAT scans first came out, we would only be able to look at it in one plane. Now we can look at things in real time in multiple planes. For smokers, that's very important because the American College of Radiology supports lung screening, and there's a certain population where we can find cancers early enough that it actually will make a difference that you will find them. So not just for treatment, but maybe we will be able to find it early enough that someone can actually be cured or prevented from having advanced disease. And we can see things very well in real time in 3D, and it's much more accurate.
Nuclear medicine is a broad category of imaging, somewhat similar to CT and MRI. Within nuclear medicine, there are a multitude of things that we could be investigating. The big difference between nuclear medicine and CT or MRI is that it's very much a functional exam. So we're looking at the function of the heart, the function of the kidneys, the function of the liver. So depending on what it is that we are looking for, we tailor the exam to fit the needs of the patient and the requesting physician.
Florida Hospital in Waterman was the first institution in Lake County to bring Spect CT nuclear medicine imaging to the county. Now what that does is take nuclear medicine scans and you fuse it with a CAT scan so that we can actually, just like in a PET scan, see where the abnormality is.
CMI is a wonderful addition to Florida Hospital because it allows the patients, instead of having to come to the hospital where people are sick, where there are potential infections, they can go to an outpatient imaging center which is staffed by the same physicians as Florida Hospital. When you get your imaging done at CMI, it's immediately available to everyone in the Florida Hospital system, so the continuity of care is preserved. We don't have to go searching for exams. It's all present in one area.
For more information about CMI's board-certified radiologists and for contact information, please click the Lung Cancer Story link on our homepage, yourhometownhealth.com.